Chapter 10: The Resurgence of Infectious Diseases Source. Introduction to Public Health by Mary-Jane Schneider, Jones and Bartlett Learning. By the 1960s, it seemed like the battle against infectious diseases had been won. Smallpox was gone, polio was on its way out, antibiotics and vaccines were saving lives. But then came HIV, then Ebola, then drug-resistant bacteria. This chapter tells the story of how old threats returned and new ones emerged, challenging everything we thought we knew about controlling infectious diseases. AIDS, the wake-up call. The 1981 discovery of HIV/AIDS shattered the illusion that infectious diseases were under control. HIV is a retrovirus that attacks the body's immune system, specifically CD4 cells. It can remain dormant for years, gradually weakening the immune system until the body is vulnerable to other infections. Transmission routes include sexual contact, shared needles, mother-to-child transmission, blood transfusions. By the early 2000s, more than 38 million people worldwide were infected. In the US, minorities and marginalized groups bear a disproportionate burden. Today, heart controls HIV but doesn't cure it. Patients live longer, but the virus can still hide in reservoirs. Drug resistance remains a challenge. Emerging and re-emerging viruses. HIV wasn't the only virus to make a comeback or debut. Other emerging threats include Ebola, highly fatal, spread through contact with infected fluids. Zika causes birth defects, transmitted by mosquitoes. West Nile virus, spread by birds and mosquitoes, first hit the US in 1999. SARS and COVID-19, respiratory viruses that spread rapidly and globally. Many of these viruses originated from animals, a reminder that human health is deeply connected to ecosystems. Environmental and global factors. Why are these diseases emerging now? Factors include deforestation and urbanization, industrial farming and animal crowding, international travel and trade, political instability and healthcare breakdowns. Diseases once contained in remote areas can now cross continents in hours. Influenza. The constant chameleon influenza isn't new, but it's constantly evolving. The flu virus mutates every year. That's why we need new vaccines each season. But sometimes new strains emerge, like in 1918, when a pandemic killed over 20 million people. Bird flu, swine flu, and H1N1 are all examples of dangerous new strains. Scientists watch for warning signs by collecting viral samples globally and trying to predict the next mutation. Flu teaches us the next pandemic could come at any time. Bacterial resistance. The return of old foes. Bacteria haven't stayed quiet either. Many old infections, like E. coli, strep, and staph, have evolved into drug-resistant superbugs. Examples: MRSA, a deadly staph infection found in hospitals. Group A strep, once mild, now capable of causing toxic shock and death. E. coli 0157. H7, a foodborne pathogen that causes kidney failure. Why is this happening? Overuse of antibiotics in humans. Use of low-dose antibiotics in livestock. Patients not finishing prescriptions. This is evolution in action, and it's making once curable diseases dangerous again. Tuberculosis. A global comeback. Tuberculosis used to kill 1 in 5 people in the US. It was nearly eradicated, then came back. Why? The rise of HIV, homelessness, and crowding. Poor adherence to antibiotic treatment. TB is airborne and slow to treat. If patients stop taking meds too soon, the bacteria become resistant. Today we face MDRP and XDR-TB strains, some with fatality rates over 50%. The best solution is directly observed therapy, where health workers ensure each dose is taken. It works, but it's resource intensive. Prions, a new kind of threat. In the 1990s, scientists discovered prions, infectious particles made of protein, not DNA or RNA. They cause diseases like Creutzfeldt-Jakob disease in humans, mad cow disease in cattle. Chronic wasting disease in deer. People can get variant CJD from eating contaminated beef. Prions resist heat and disinfectants, making them especially hard to eliminate. Why diseases are resurging? Why are these infectious diseases making a comeback? There are 4 major drivers. Global travel and trade. Infections can now cross borders within hours. Environmental disruption. Deforestation, climate change, and habitat loss bring humans and animals closer together. Vaccine hesitancy, fear, misinformation, and declining trust reduce immunization coverage. political instability, and weak health systems. Conflict and resource gaps delay response. Together, these forces weaken our defenses and allow old and new diseases to spread more easily. Global response and bioterrorism threats. The modern response to infectious disease includes global surveillance, investment in new vaccines and drugs, bans on non essential antibiotic use in livestock, focus on vector control. We also worry about bioterrorism, deliberate use of viruses or bacteria to cause harm. The 2001 anthrax attacks prove this is real, but the public health tools are the same. Watch for unusual patterns, isolate quickly, communicate clearly, protect healthcare workers and the public. The new public health battle. The fight against infectious disease isn't over. Yes, we've made progress, but progress is fragile. The tools still work: surveillance, treatment, education. But they only work if we continue using them. Fund public health infrastructure. Rebuild trust with the public. We need to focus not just on emergency response, but on long term prevention. Because strong public health systems don't just stop outbreaks, they prevent them from happening in the first place. Conclusion: we once believed infectious disease was behind us. We were wrong. From HIV to COVID 19, from superbugs to zoonotic viruses, infectious diseases continue to evolve, and so must our response. The core lesson: public health must remain strong, flexible, and globally connected. The tools we've always used, surveillance, vaccination, treatment, education, still work. But they need funding, support, and trust. Because in the battle between humans and microbes, complacency is the real killer. Call to action. This presentation is based on Chapter 10 of Introduction to Public Health by Mary-Jane Schneider, 5th edition, published by Jones and Bartlett Learning. If this helped you understand the resurgence of infectious disease, share it. And in the comments, tell us what's one public health strategy we need to invest in most today.